Alpha-1 agonists or sympathomimetics are medications that stimulate a sympathetic nervous system or fight-or-flight response on target tissues containing alpha-1 receptors. The medication binds to alpha-1 receptors, mostly found on smooth muscle throughout the body, particularly in blood vessels, the eyes, and the urinary bladder. This binding leads to the contraction of smooth muscles, causing vasoconstriction in both veins and arteries, mydriasis or pupil dilation, and contraction of the urinary sphincter. There are three main alpha-1 agonists available: phenylephrine, midodrine, and oxymetazoline. Phenylephrine can be administered intravenously and is used to treat hypotension, especially when caused by shock and general or spinal anesthesia. Vasoconstriction increases systemic vascular resistance, raising blood pressure. In addition, vasoconstriction of veins improves blood return to the heart, increasing cardiac output, or the amount of blood the heart pumps out with each beat, further increasing blood pressure. Phenylephrine is also available orally and as a nasal spray. In this form, it is used to reduce nasal congestion caused by colds, allergies, and hay fever. By constricting blood vessels in the nasal cavity, nasal congestion is decreased. Phenylephrine also comes in the form of eye drops and is used to dilate the pupil for eye exams and procedures. Meanwhile, oxymetazoline, available as eye drops, is used to treat eye redness caused by swimming, colds, and contact lenses. Oxymetazoline is also available as a nasal spray, and like phenylephrine is used to reduce nasal congestion caused by colds, allergies, and hay fever. And finally, midodrine, available orally, is used to treat orthostatic hypotension and urinary incontinence. Alpha-1 agonists can cause several adverse effects. Intravenous phenylephrine can cause bradycardia due to increased blood pressure stimulating baroreceptors in the aortic arch, which can activate the vagus nerve, causing a decrease in heart rate. If the dose of intravenous phenylephrine is too large, it can also lead to hypertension. Furthermore, when used topically for nasal decongestion, phenylephrine and oxymetazoline can cause rebound congestion when stopped due to tissue dependency, especially with prolonged or excessive use. Alpha-1 agonists can also cause urinary hesitancy, supine hypertension, insomnia, nervousness, and paraesthesia, or a pins and needles sensation. The risk of adverse effects is greater when using systemic alpha-1 agonists in higher doses. Midodrine is contraindicated with urinary retention, acute renal disease, severe organic heart disease, and persistent supine hypertension. And caution should be used when using intravenous phenylephrine with heart failure, coronary artery disease, and peripheral arterial disease. Intravenous phenylephrine requires frequent blood pressure monitoring and continuous telemetry to assess response and monitor for bradycardia. If phenylephrine is used for a prolonged period, such as with an infusion, a central line for administration and an arterial line for continuous blood pressure monitoring is preferred. However, short-term use, typically given as an IV push, can be administered through a peripheral IV, preferably in a large vein. But in this case, close monitoring is necessary to avoid tissue necrosis due to extravasation or leakage of the medication into surrounding tissue. Additionally, if the heart rate is less than 60 beats per minute, intravenous phenylephrine may need to be substituted for a different vasopressor due to the increased risk of bradycardia. And finally, midodrine should be avoided 4 hours before bed to reduce the risk of supine hypertension. I hope you found this video useful, and if you did, please let me know by giving this video a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!